Hello friends, welcome back to my channel. Question number first. Morphine is the drug of choice for option A urinary tract infection, option B bronchial asthma, option C colic pain, option D cardiac asthma. Correct answer is option C colic pain. Morphine belongs to the group of medicine called narcotic analgesic. Next question. Drug used in the treatment of bronchial asthma. Option A block both alpha and beta adrenergic receptor. Option B stimulate alpha receptor but block beta receptor. Option C stimulate beta 2 receptor but block alpha receptor. And option D stimulate alpha and beta receptor. Correct answer is option C stimulate beta 2 receptor but block alpha receptor. Okay. Drug used to treat bronchial asthma include beta 2 antagonist which stimulate beta 2 receptor on bronchial smooth muscles, antichologenic which blocks the effect of acetylcholine. Next question. Which vitamin is useful in the alcoholism? Option A thiamine, option B folic acid, option C pyridoxine, option D ascorbic acid. Correct answer is option A thiamine. थायमिन विटामिन B1। थायमिन को किस नाम से जानते हैं? विटामिन B1। थायमिन किसे कौन सी डेफिशिएंसी हो जाती है? मसल्स वीकनेस, बेरी और मेंटल कन्फ्यूजन्स। नेक्स्ट क्वेश्चन। Clopramazine act as antipsychotic drug by option A blocking dopamine receptor, option B blocking GABA receptor, option C blocking muscarinic receptor, option D blocking conduction of impulses. Correct answer is option A blocking dopamine receptor. Antipsychotic medicine help to adjust the level of dopamine and other chemical available in your brain. Or chlorpromazine reduce dopamine activity where it is too high, helping with symptoms like hallucinations. Next question. Which one of these possesses muscle relaxant property? Option A chlorpromazine, option B diazepam, option C phenobarbital, option D chlordiazepoxide. Correct answer is option B diazepam. Diazepam used to relieve symptoms of anxiety and alcohol withdrawals. Next question. Oxazepam is a metabolite of option A diazepam, option B rozepam, option C chlorodiazepoxide and diazepam, option D alprazolam. Correct answer is option C. Next question. Alprazolam is administered in a dose of option A 5 to 10 mg daily, option B 0.25 to 5.0 mg thrice times a day, option C 10 mg daily, option D 10 mg thrice time a day. Correct answer is option B 0.25 to 0.5 mg thrice a day. Alprazolam used to treat anxiety disorder like panic disorder और ये कौन सी क्लास से बिलोंग करती है? बेंजोडाइजिपाइन से। नेक्स्ट क्वेश्चन। द टेबलेट लिब्रियम कंटेन ऑप्शन ए ट्राइजोलम, ऑप्शन बी क्लोरोडाइजेपोक्साइड, ऑप्शन सी एल्प्राजोलम, ऑप्शन डी लोरोजिपम. करेक्ट आंसर इज ऑप्शन बी. नेक्स्ट क्वेश्चन. बेंजोडाइजिपाइन इज यूजफुल इन द मैनेजमेंट ऑफ स्टेटस एपिलेप्टिकस. ऑप्शन ए डाइजिपम, ऑप्शन बी एल्प्राजोलम, ऑप्शन सी नाइट्रिजिपम, ऑप्शन डी ट्राइजोलम. Correct answer is option A. Next question. Dopamine act by blocking the option A reuptake of norepinephrine, option B reuptake of serotonin, option C reuptake of GABA, option D reuptake of dopamine. Correct answer is option A. Next question. Desperamine is a metabolite of option A amitriptyline, option B imipramine, option C imyacillin, option D trazodone. Correct answer is option B. Next question. Which one of these drugs is prescribed in nocturnal neurosis? Option A trazodone, option B imipramine, option C alprazolam, option D miprobate. Correct answer is option B. Next question. Bromocriptine is option A semi-synthetic ergot alkaloid which mimic the action of dopamine. Option B synthetic drug which mimic the action of dopamine. Option C semi-synthetic ergot alkaloid which easily converted into dopamine. Option D none of these. Correct answer is option A is the correct. Semi-synthetic ergot alkaloid with mimic the action of dopamine. Next question. In case of hypothyroidism, the preferred thyroid preparation is option A levothyroxine, option B dextrothyroxine, option C leothyroxine, option D none of the above. Correct answer is option C leothyroxine. Next question. The anticoagulant heparin is obtained from option A sheep's lungs, option B dog kidney, option C rabbit heart, option D rat uterus. Correct answer is option A sheep lungs. Heparin commonly used as anticoagulant. Next question. Which one of the following type of adverse drug reaction are not believed to be dose-related phenomenon? Option A side effect and toxic reactions, option B toxic reaction and hypersensitivity, option C side effect and hypersensitivity, option D hypersensitivity and idiosyncrasy. Correct answer is option D hypersensitivity and idiosyncrasy. Next question. The loading dose of a drug is based upon the option A time taken for complete elimination, option B percentage of drug excreted unchanged in urine, option C percentage of drug bound to plasma protein, option D apparent volume of distributions and desired drug concentrations in plasma. Correct answer is option D. The loading dose of drug is based upon the apparent volume of distributions and desired drug concentrations in plasma. Next question. The hypotension effect of clonidine is due to its action on option A beta-adrenergic receptor, option B alpha-adrenergic receptor, option C H2 receptor, option D H1 receptor. Correct answer is option B alpha-adrenergic receptor. Next question. Sodium nitroprusside is one of the limited because of most potent blood pressure lowering drug. It is used in option A its short duration of action, option B very long duration of action, option C effective in oral uses, option D none of the above. Correct answer is option A its short duration of action. Sodium nitroprusside is a vasodilator used to treat variety of the conditions. हाइपरटेंशन इमरजेंसी में यूज़ करते हैं, एक्यूट हार्ट फेलर में, पेरिफेरल हाइपोटेंशन में और एक्यूट एरोटिक डिस्क्रेशन में. नेक्स्ट क्वेश्चन. यूज ऑफ आइसोनिस्ट इज restricted due to option A ototoxicity, option B hepatotoxicity, option C neurotoxicity, option D bone. Answer is option A ototoxicity. Isoniazid is a commonly used antibiotic to treat tuberculosis. Next question. Sodium valproate act by option A blocking the metabolic of GABA, option B blocking the GABA receptor, option C blocking the conduction of impulse in brain, option D blocking the release of GABA. Correct answer is option A blocking the metabolic of GABA. Next question. Phenobarbital is metabolic product of option A amobarbital, option B barbitone, option C pyrimidine, option D pyrimidone. Correct answer is option D. Next question. Xanthine base like caffeine act as CNS stimulant because option A they inhibit the phosphodiesterase enzyme responsible for degradation of cyclic AMP, option B they release the catecholamine, option C they act on cerebrum, option D they inhibit the enzyme monoamino oxidase to increase the concentration of catecholamine. Correct answer is option A They inhibit the phosphodiesterase enzyme responsible for degradation of cyclic AMP. Next question. Which one of these is most useful in bronchial asthma? Option A caffeine, option B hypogenethine, option C theophylline, option D theobromine. Correct answer is option C theophylline. Next question. Physical dependence is a condition in which option A the body needs the drug to maintain the normal physiological functions. Option B there is a compulsive need of drug. Option C the body often needs the drug. Option D any of the above. Correct answer is option A. The body needs the drug to maintain the normal physiological functions. Next question. Bisacodyl is a option A bulk forming laxative, option B irritant laxative, option C emollient laxative, option D osmotic laxative. Correct answer is option A bulk forming laxative.